Recording in progress.
Yeah, okay. Yeah.
Hello, everyone. I think we can start. I will just show you a quick video to introduce you to Catalyzing Change Week. And then I can...
Welcome to Catalyzing Change Week. This year's Catalyzing Change Week is about solutions from the front lines by social innovators. In 2022, Catalyst 2030 concentrated its efforts on bringing proximate leaders and frontline solutions to the forefront. Collaborations led by members from the Global South produced groundbreaking reports on climate and transforming education, with an emphasis on offering local solutions. We continued our mission to create an enabling environment for social entrepreneurs to flourish by initiating a letter to donors, signed by more than 1,200 social entrepreneurs and innovators. The Catalyst 2030 awards ceremony was spectacular, and the awards themselves welcomed by the private sector, governments, via multilaterals and donors.
Catalyst 2030 as a movement is disruptive. One of the best things I think that's come out of Catalyst 2030 so far is that just didn't exist before Catalyst came into being.
The thing I love most about Catalyst is that it's an open movement for social entrepreneurs around the world. I'd encourage anyone who's looking to be more connected with their local communities around social development goals to come along to Catalyzing Change Week.
Welcome to Catalyzing Change Week.
Okay. Whenever you want to start, I think we're ready.
We can start.
Thank you, Waila. Good morning, good afternoon, everyone. Really happy to have you today with us for the Catalyzing Change Week. Thank you so much to Catalyst 2030 for giving us this platform to discuss this very important topic. I'm Anshu Taneja from Vision Spring, and I'll be moderating the panel discussion for today. The topic for today's discussion is how to make roads safer for all. May I request everyone to mute their microphones, please? Thank you. So, how to make the roads safer for all? This is a very critical topic.
You're muted.
Can you hear me now?
Yes.
Okay, thank you. So we're discussing a very important topic today. More than 1.5 million people every year lose their lives on roads. 13% of those fatalities are in India, which is huge. You know, if you look at it, 18 people would die every hour on Indian roads. So by the time we finish this panel, we would have lost 18 lives. So such is the importance of this subject. As you're aware, in September 2020, United Nations passed this resolution as per the SDG 3.6 to reduce the road accidents and fatalities through road accidents by half by 2030. And it called 2021 to 2030 as the decade of action on road safety. So joining us to discuss this important topic today is a stellar panel. I'm really pleased for all the panelists to have spared their valuable time on a Tuesday afternoon to get together to discuss this important subject. May I first introduce Dr. Praveen Vashisht. Dr. Vashisht is the head of community ophthalmology at the Dr. RP Center at AIIMS, New Delhi. He's also the vice president for Vision 2020 Right to Sight India. He's a stalwart in the field of eye care and very passionate about public health and very passionate about road safety as well. So thank you, Dr. Vashisht, for joining us. Next, we have Mr. Arun Arora. Mr. Arora, heads strategy, communication, and overall operations for the Chetak Foundation and Maven. Again, a seasoned professional, both in the for-profit sector as well as in the not-for-profit sector, having stints for over 3 decades in organizations like Vedanta, Maruti, and many others. He's extremely passionate about road safety, and he's also a communication expert. So would love to know his views on this important subject and how we create more awareness around it.
Thank you, Anshu.
Thank you. Next, we have Mr. Ramashankar Pandey, CEO of Tata Green Batteries, formerly MD and CEO of Hella India Lighting. He's on several committees on road safety of ACMA, FICCI, and many other forums, and propagating the awareness and importance of road safety. So welcome, Mr. Pandey. Next, let me introduce to you Ekta Kumar. Ekta is a sustainability professional, very passionate about road safety, formerly heading CSR for Samsung India and Shell India. She's been instrumental in making sure hundreds of thousands of commercial drivers around India have clear vision through glasses. So thank you, Ekta, for joining us today.
Thank you, Anshu, for having me.
And finally, we have Rajni Gandhi, who is the co-founder and secretary general of TRAX. TRAX is one of the largest and the most important NGOs on road safety. She's also board member of the Global Alliance for NGOs of Road Safety, and also passionate advocate on the subject. So thank you, Rajni, for joining us.
Welcome. Thanks for having me again. Thank you.
So with that, I would direct my first question to Mr. Ramashankar Pandey, if he is there. Yes, I can see him.
Yeah,
yes.
Hi, thank you.
Welcome,
Thank you.
sir.
Sorry for the delay.
So, Mr. Pandey, road safety is a big problem in India. We just went through some of the statistics. So it's a problem which is a global problem, but in India it gets pronounced. So if you could shed some light on the issue of road safety, as we set the context for today's panel discussion, especially the impact that road safety can have on the growth and economic development of our nation. Over to you.
Thank you so much, Anshu. Thank you so much. First of all, thank you for all the passionate people who I can see on the screen. Ekta being here, Rajni being here, Mr. Arun Arora and Dr. Praveen, thank you so much for collaborating on this topic, which is so critical for the country. If you look at today, as all of you know, that millions of us use roads, and roads have become integral to our life. In past, it was rivers, but now the whole locality, everything is on roads. And then when you know about the negative side of this road revolution or transportation in our country, because we belong to automotive industry, and we feel so bad that every day, roughly 415 families does not get back their people home. And this is day after day. It just continues. Despite all the regulations we are trying to do, despite all the vehicle engineering we are trying to do. So it pains us as an industry. And it has a direct business linkage, because also for the automotive industry, if we don't want to be seen as a killer industry, we want to be seen as a green industry. And when we see that every day on newspapers and in the media, so many news we get for people dying on the roads, I think this is not acceptable to many of us. Having said that, the ramification or the economic cost is so high, for the country. Everyone who is dying as of today is mainly coming in the youth segment, in the young population, which is a working class. You and me. Actually, it is beyond business. It's about you and me. In fact, you take it as a average data, what is today. I'm talking about the simple average data from the government of India, not from the WHO or not from the underreporting, but something which is reported by the crime police. And there you will see that if the same statistics we take for a working life of 30 years or 35 years, 1 in every 4 of us has a chance to get a road crash. So this is very normal. Anyone who is on this call, that means he is working somewhere. In our working life, 1 in 4 will have a road crash in our country statistics. And roughly 1 in 13 will have a fatal crash. Now, this cannot be left unattended. And that is why we, from the industry side, from the corporate side, we have seen how the industrial accidents have been, come down. And I think Ekta will vouch for it that in the industries, we have inside the industry also a lot of chance of accident, but there the safety professionals have done a very good job. Excellent job, I will say. The rate of incidents has come down dramatically. So there's a hope that we can reduce it. And that's why it is very critical for corporate to take a leadership position, that what they have done inside their ecosystem, now we want to take it outside. Unfortunately, the stakeholders are many in the road crash. It's not only that it's all in our hand. We have many, many stakeholders, but we are highly motivated to give it a try or give it a full effort from our side, that what we can do to educate people, to make them aware, and most important also to assist and alert. Because what we feel from the industry side, that all these days, we have been doing a lot in terms of regulation and enforcement. In a country where enforcement is so poor, the traffic police is not many, and government has to depend on CSR money at many places to buy cameras and technology for enforcement. So you can understand how difficult the situation is. And because of that, our belief is nothing less than a public revolution can change the behavior, and to let people understand that this is a science. We want to really shout on this, that it's a science. It is not a bad luck, because many of the citizens in our country believe road crash is a bad luck. It's a superstition. And that's why you always see when when a black cat crosses your road, you will stop. जब काली बिल्ली जाती है, आप रुक जाओगे. You have those lemon and chili hanging on the vehicles, Nibu Mirchi, because you think it's a bad omen. So that is why that converting that sentiment into a scientific sentiment is role of all of us. The importance of visibility, importance of vision, the whole, I always call dekho, ruko, bacho. जब देखो ही नहीं तो रुकेंगे कैसे? If you don't see it, how can we even apply our processing power? So all the great skill and great everything is visually impaired, and that's why visibility remains a major key part. So I think in the nutshell, from my side, I can only say it's a critical problem for the country when it comes to, there's a business case for safety. All of us understand in the corporate, but the normal citizen today is not getting it that way. They feel still it's a bad luck. Chal jayega, okay is okay. And that is where we all want to come together to make people aware that it has a ramification, a huge consequence of economic damage for the family and also for the country. Roughly 3 to 5% of GDP, which is huge actually. You can imagine that every inch of growth in GDP is being talked by government, political parties so well that how much it is for the uplifting the poverty. In fact, the livelihood here is directly related to the lives. So the livelihood of our country, which is coming from the GDP, depends on the lives of these people who we are losing on the road. So I think I can go on talking about this because, personally, I feel there is a solution very close by if all of us work together. But in the end, just to summarize, we as a corporate people understand the business case for safety. Whatever we can do, we are doing inside our boundary. We would like to contribute outside the boundary also because it's a huge damage to the economy of the country. 3 to 5% GDP is not a small number. Thank you so much. Over to you, Anshu.
Thank you, Mr. Pandey. I think, love your passion towards this issue. And, the words that you said, it's science behind this. It's not bad luck, and how important it's to have a scientific approach towards this issue. 3 to 5% impact on the GDP of the nation is huge. It can be a game changer for the country if we are able to solve this issue. So thank you for making both a business case as well as a public health case towards this issue. Mr. Arora, I will now go to you, and the question to you is that you are a professional who's done great things in communication, marketing, and helped raise issues to both the national and the global level, both for business purposes as well as social issues. How do we create more awareness towards this important issue? What should we do as organizations, as the government, as society, to make sure that everyone is aware of all the good points that Mr. Pandey has raised?
Please unmute yourself.
Mr. Arora, I think you need to unmute. Yes, we can hear you now.
Yeah, thank you, Mr. Taneja. I was just taking my specs on and off. Then I realized maybe I should put it on and walk the talk, because the topic today is to have clear vision. I was actually not sure how do I look with the specs on. Then I looked at Anshu and he looks so good wearing the specs. So I immediately put on the specs. So that I thought that maybe I'll start on a humorous note. And glad to see omnipresent Rajni and Ekta at such credible forums. And such a pleasure to have Mr. Pandey and Dr. Vashisht. I'm really honored to be sharing the dais with you today at this discussion. Do I look all right with the specs on?
You look perfect.
Okay, thank you. Thank you very much, Anshu. In fact, we have collaborated with Vision Spring and we've been working on this. And in fact, in the past, I worked with Maruti and I had the fortune of working with a lot of organizations, especially since automobile create a lot of pollution. So we work in the area of environment. And in addition to that, automobiles also lead to a lot of accidents on the roads. Like Mr. Pandey was mentioning, what is the cost to the economy of the people for the fatalities? But I would like to add, in addition to fatalities, even the victims who are injured, they have some major injuries. So one is the cost to the economy, and second part is how their families are impacted, how their children are impacted. Because in India, many times, most of these people are the sole breadwinner for their families. There's a huge social impact also relating to that. So recently, currently I'm working with Chetak Foundation. Chetak Foundation is the CSR arm of Chetak Logistics. There again, we are into automobile. We run a huge number of trucks and we endanger roads for the motorists, for the pedestrian. And we also create pollution. And we closely work with Tatas because our entire fleet is sourced from Tata. So we closely work with Tatas, and currently we are working with Tatas to develop heavy commercial vehicle which will be electric driven. And Mr. Pandey is working on green batteries to kickstart that initiative. So that is one part on the pollution part. On the road safety part, sticking to the topic of this discussion, there are various things that we need to do on the road safety, including design of the roads, the way people drive, driving habits, creating awareness amongst people, and creating separate pathways for pedestrian and cyclists, and encouraging people to do the lane driving. But one topic that we need to look at is a very interesting stigma that we noticed, especially amongst the truck drivers. Can you believe they don't like to get their eyes tested? And as per the estimate that even Vision Spring keeps sharing with us, more than half of the existing truck drivers do not have vision good enough to drive on the road. And they choose not to go for eye testing. Can you believe that? There's a stigma attached that in case you get your eye checked, and in case they discover that they have, incorrect eyesight, so they may end up losing job. So in addition to creating awareness amongst the driver, we need to create awareness amongst the promoters of logistics companies or automobile companies to assure their driver community that it is all right to get your eyesight tested, get the spectacles, get the correct vision, which will not only make you safer, it'll make your fellow motorists safer, it'll make pedestrians safer, and it'll enhance your productivity. So you'll be better employed, you'll be earning better, you'll be adding more value to the organization instead of being scared of getting your eyesight tested. In fact, we've been organizing camps along with Vision Spring across India, and we find it a challenge to conjure up 100, 150 people that we can check in a day. But we are very confident, and we are quite enthusiastic about it, and we've set ourselves a target of testing eyesight of 1 million drivers over next.
May I ask everyone to mute? Thank you.
Yeah, somebody who mutes quickly gets a free spectacle, courtesy, Vision Spring. Okay, so we find it difficult to conjure up 100 and 150 drivers that we can check in a day. But we've been making all possible efforts, and we have set ourselves a target of touching 1 million truck drivers over the next 5 years, wherein we'll be checking their eyesight and we'll together provide them with free spectacles. That is the kind of target we've set for ourselves, and we are progressing very well on that front. Now, there are very small things that we need to touch upon. Who all do we communicate with? What messaging do we carry? Do we continue to speak in English, or do we go into vernacular language? Because people who the target audience are, they may be more comfortable in their respective local languages. So we need to customize our communication to address to the actual audience, the targeted audience. That is one part. Second is, what is the messaging that we're giving? Can we make it very simple? Because otherwise, often we come across a lot of posters which are issued by the transport department. They tend to be so boring. Can we make them very interesting? For instance, if you look at all of us who are hooked on to those Amul ear panel ads that they keep coming out for years together, and they manage to have some good sense of humor, they tend to relate it with the current situation, and they come out with very interesting cartoon almost every day. Similarly, can we think of some innovative, creative ideas? And I would personally love to collaborate with anyone who's keen to take up this with us in order to have some interesting awareness campaign, which actually strikes the target audience and prompts them to take quick action. That is one that is on the awareness front. Second is, it's not a favor that you're checking their eyesight. It's not a favor that you're giving them free spectacles. You are actually making your own company better. For instance, whenever we find partners, first thing that we look at in a partner is what's in it for both of them. For instance, what's in it for them before what's in it for me. If we can satisfy both the parties, then this collaboration is very, very fruitful. One example is the Chetak Foundation's collaboration with Vision Spring, which is quite interesting, quite fruitful. I think let me take a pause here. I'm sure we can come back because we have a couple of other speakers also. Let's take their views and we can come back and continue my point of view also.
Sure. Thank you, Mr. Arora. And I think, also appreciate all your contributions to helping drivers see clearly. And I think very valid points in terms of how we could more effectively communicate regarding the cause. I'll now go to Professor Praveen Vashisht. So the question to you is, clear vision is an eye health issue, but it has such a profound impact on road safety. You know the statistics better than anyone else. But can you elaborate a little bit more on the extent of the problem? There are a lot of people joining today who are experts in the field of road safety, but may not know about this simple solution, which can save a lot of lives on our roads. So over to you, sir, to speak a little bit more about importance of clear vision for road safety.
Thank you, Anshu. I'm audible?
Yes, loud and clear.
So thank you for taking this initiative of road safety. In fact, Mr. Arun Arora has given a brief information about this thing. But I would like to mention, when people of non-medical background, they talk about road safety, and many times they even forget about the vision, the clear vision and an eye problem. This is commonly seen in different form. But if I have to count one major factor for road accident, this is probably the vision problem. Most of us, if you define various causes of visual impairment, at present, if you take overall population, then 5% of population is considered as visually impaired when I'm talking about distance vision. And when we add near visual acuity along with the distant vision, then overall proportion has increased to nearly 25% of population. Globally, 2 billion people are visually impaired as per WHO criteria at this stage that include distant vision and near vision. So in India also, we have recently conducted survey, and we have found that the latest figure is that nearly 70 million people are visually impaired, affected with the distance visual acuity of vision. We use a chart called Snellen's chart. If a person cannot read 6/12 with both his eyes, then person is labeled as visually impaired as per WHO criteria. So this is a huge number actually. And among the causes, what I have always observed, that most of us, they talk about spectacles only, that the spectacle or refractive error is the only cause. Believe me, nearly 50% cause of visual impairment is refractive error. But there are other diseases also, which is even more important than refractive error. Cataract is the leading cause of blindness in our country. And if see in 50+ population, now driving is seen in 50+ age group also. I am also 50+ now. And even up to 70 people are driving. Most common cause of blindness in our country is cataract. Recent survey showed that even it is much more, even the severe visual impairment is more due to cataract rather than refractive error. And we have to think that, and the treatment of cataract is not spectacles. You have to go for surgery. So this is one area we have to look forward, is all 50+ people who are actually driving or not driving, if their vision is impaired, their visual acuity is less than 6/12 or 6/18, must go for surgery. And one more disease, glaucoma, or commonly like people call it kala motia. The cataract is safed motia, glaucoma is kala motia. The problem in glaucoma is that it affects the side vision. The driver, if seeing in front, he can see it right, that he feels his vision is perfect. But his side vision is affected. If he's turning a vehicle and somebody is there on the side, probably chances of accident are much more. And glaucoma is apparent as nearly, like some of the surveys show, even 20% blindness is because of glaucoma. The worst part of glaucoma is that the treatment, once the vision is gone, it cannot be retained back. Whatever is gone is gone. In cataract, even the person is blind, you operate that patient, he can have a normal vision. But in glaucoma, once the vision is gone, it is irreversible cause of blindness. And the most, another one is the diabetes. Diabetes affect eyes also. It lead to diabetic retinopathy and affect the vision later on. In US, it is the most important cause of blindness and visual impairment. In India, because we have cataract and refractive error. We are not even able to provide spectacles. That's why DR is not apparently so high. But actually in future, when we will be able to tackle refractive and cataract, it will become most important cause of visual impairment country. So even diabetic patient, they need to take care, they need to take treatment for, and of course, that also affect the, it's a concern for road safety. So you can understand the huge burden and people, and even at this stage, as Mr. Arora mentioned, that spectacles are most important. Most of the drivers, they don't want to wear spectacles. In fact, they don't realize that they have refractive error. You know, they assume that everyone is seeing like this only. Once they wear spectacles, they understand this is what clear vision is. And then they understand, yes, it is important to wear spectacles. But some drivers, what I have observed is that they don't want to even show that their eyes affected, and when somebody is wearing spectacles, people perceive that they have some kind of eye problems. And that's why they avoid wearing spectacles. So these are all the issues that need to be taken, and we need to create awareness that whatever people think, using spectacles is better than not using spectacles. I think this is the overall burden which I wanted to share. Thank you.
Thank you, Dr. Vishisht, for putting it very nicely in terms of, from a health perspective, what are the different issues in terms of vision also that we can look at. And I know you've been a passionate advocate of this issue. In our experience, Vision Spring, we've screened more than 575,000 drivers in India now. And we found that 63 to 64% of them need glasses. And more than 70% of them, after they got their glasses, were the first-time wearers. So that's how pronounced the problem is. Commercial vehicle drivers require every 3 years their licenses to be renewed. And eye checking or testing for vision is an important part of that process. But unfortunately, that's never complied with, and it's important that we do a better enforcement. Though rules are there, but unfortunately they're not enforced to the extent we would like to have them enforced. Also, I remember one of a person that we were screening, a bus driver in Manali, who was driving in the hills and going as long a distance as Kashmir from Manali, and had mature cataract in both eyes. So basically, the bus driver driving on instinct without having proper vision, and thus endangering not just his life, but lives of so many others. That's something that makes us think as we go out on the roads and or sit in public transport. This is how critical that issue is. We've kind of the first half hour made a base. We've discussed on what the issue is and how important it is. So let me now go to Rajni, who's been working in the field of road safety and an expert in terms of looking at some solutions to this issue. So Rajni, if you could, you are also on the board of the Alliance for NGOs on Road Safety. You've done phenomenal work with TRACS. Could share some of your experiences on how certain collaborations and partnerships have worked effectively in the road safety space? Because as we are learning more on how we would, provide clear vision to drivers, it's important to learn some lessons from the road safety world. So share some experiences of where you have collaborated with other organizations or the government to solve an important road safety challenge.
Yeah. Hi, Anshu, and thanks for bringing such a good questions to me, because I think we have heard from the experts who have actually made a base that why such issue is neglected, and now it is a time we should talk about the clear vision. because we have also been working with many commercial drivers, and we have seen this is an issue. And when we come to the partnership, so, if we talk about partnership, so road safety is such an example where road safety is such an example that we are putting the things in a collaboration way. And the decade of action, if I talk about the decade of action in 2011 to 2020, and then it is 2021 to 2030. It is all about the collaboration that different organizations across the world, World Health Organization, United Nations, and NGOs working in the different countries. Then in the national level, if we talk about like we have also collaborated with different NGOs, and we come out with the different solutions. One of the case study I'll definitely share that you have asked for. And secondly, in case of structure, the partnership, I really appreciate the role of the Supreme Court Committee on Road Safety here, because after coming into the picture, they have actually structured road safety in a different way. Now we have state road safety, councils. We have district road safety meetings also everywhere. We are also member of many district road safety committees as well. So what is happening there? All stakeholders are coming on one table every after a month or quarter or in a way, and they are discussing about the issues to take the road safety issues on the next level. The point which I want to stress upon here, because we are using this platform. So I think one of the important points we should not miss of any partnership is the accountability. Till the time as a stakeholder, I will not put an accountability on my shoulder or on me, that if I am participating or I am responsible for this, so I have to complete this task within this time. So that's a problem we are still facing, and not in our country. I think in many, many other countries also, some sort of issues are coming where, stakeholders are not so much active, or the willpower is still to be active more from the authoritative side. So these are the points which needs, once you have a partnership, that is fine. But on the second level, how you are putting the accountability, that is very important. So in that way, I just want to give one example to you in case of our collaboration. We have started the helmet advocacy in 2014 to 15 near about. And we have started fighting for the fake helmets. Like this should not be, this is not acceptable at all, and we have to do something for this cause. So we have started, and then slowly and steadily, many stakeholders, rather, I'll say, even not national, we have got international support also, while we were fighting for the listing out the helmets into the BIS list also, mandatory list, because it was not the part of the mandatory list. And many other NGOs were also working on the same issue. And slowly and steadily, yes, other stakeholder, district to district, state to state. And finally, in 2020, we got this, gadget from Ministry of Road Transport and Highways. And they have issued this, that now this is under this regime. And no fake helmets can come into the picture. And another point was that we have collaborated with NGOs. We have reached, number of NGOs, and we have made a Helmet India coalition. So many NGOs, many stakeholders, even rather the riders who are very much professional riders, they have collaborated with us. They have taken this issue in their cities and in their states also. We have started one campaign also in 2020 when COVID was happening. So we have tried to make a maximum opportunity while sitting in home also, what we can do for road safety. So we have started one campaign called Breakup Campaign. Breakup campaign means let's break up with the fake helmet or substandard helmets. And we got a very good result from different part of the country. They have come together and many authorities have actually issued the notification in their cities and districts and states that yes, we want standardized helmets on roads. Recently, also, we had a very great meeting in one of the state road safety meeting. And there we are going to decide for the modus operandi that how to control the manufacturing of the, fake helmets or substandard helmets. So and even if I did remember the international community, we have put the online petition also for putting the helmets into the BIS list and for the fake helmets. So many international organizations also have come forward and they have signed that petition also, which straight away was very helpful. So this is what one of the solution we have come out while doing all the work in collaboration way. Many international organizations have published our case studies that how it can be done and how the collaboration in India is actually effectively working on the safety of two-wheeler riders, especially. So this is one of the case study, and moreover, because everyone feel their accountability, all the NGOs who have come together, or the riders, or the stakeholders, that's why we have been able to successful. And one of the important points that we have a CMVR rule 138(4)F, under which the OEMs, the dealer of two-wheeler, they have to provide a helmet, new helmet with a bike. But that was not implementing, and it was mentioned in the 1989 CMVR Act. So we have started following it up, and I'm very happy to share that 18 states and 2 union territories have already issued the notification and implementation has been started. Some of the government even asked the dealers to provide 2 helmets instead of 1 for the pillion riders also. So we have, on one hand, we have a good law. So we need to implement it in a collaboration way. And somewhere, if we don't have a law, we need to make collaboration to advocate for that. That's it.
Thank you, Rajni. Wonderful points. I think congratulations to all the efforts that TRACS has made and you have made personally. And, you've shown that things are possible. On that optimistic note, let me go to Ekta. Ekta, we've heard from Rajni on how things are possible if we work through collaborative action. So how do you, feel that we should approach the vision and road safety issue? How can we put a collaborative effort around that? And if we do that, what are the top 3 things, say, that we would like to achieve?
Firstly, Anshu, I think it's been such a lovely, conversation so far, as in right from Mr. Rama, who's like the most passionate person I've met in road safety. And then Mr. Arun, Rajni, Professor Praveen, everybody has brought in so many wonderful insights into this, challenge that we have around road safety, and how obviously clear vision plays a very important role in terms of, making our roads safer. The question that you ask around collaboration, Anshu, is a very pertinent question. As in, I would like to kind of recall something that we recognize as a crisis that happened in the near past, and how everybody collaborated on it. So we saw COVID-19 come into the country. We saw how the government immediately kind of geared up for it and said, okay, there's going to be a lockdown because we need to stop the spread of, this virus. We saw how corporates immediately jumped into action. Corporates who never believed in a work from home, who had never tested it, who never ever knew whether their IT systems could support something like that, but immediately made it possible, right? And had their, employees working from home. As individuals, we were wearing masks, we were sanitizing our hands. And as NGOs, there was a whole lot of work being done by them because they recognized in your team, yourself, Anshu, on the road, giving food, giving groceries to the people who do not have the luxury of a laptop and a work from home, and who were losing out on their daily wages because of this, lockdown. So we all understand what the word collaboration means, as in this is not new to us. It's just that we don't understand that this is a crisis. I think that's the bigger issue right now that we need to, talk about. If we saw this whole road safety thing, if we saw what you said in the beginning of this conversation, that, 18 people die every hour, even in COVID, I think the numbers were similar or maybe lower, and yet we had a lockdown. So I think the whole piece around collaboration needs to be that first everybody has to be on a common ground in terms of understanding that this is a crisis and something needs to be done about it. So that for me is the starting point. And I think not enough has been done and said about it. Like, all of us who understand and work on road safety recognize that, 18 people will, not be with us at the end of this hour. I don't know if the others see it and, understand it with that kind of a magnitude. The second piece that Anshu, I think that also needs to be done for people to understand this crisis is a little bit of a pilot at different locations with different segments, which you have again, Anshu, been instrumental in driving. And that's something that, in fact, when I was with Shell, was instrumental in selling the whole concept of, clear vision for road safety to both my internal and external stakeholders that yes, 60-65% people are walking out with glasses. Right? Obviously, you don't want to say that all of road safety will get solved with clear vision. There are many other aspects as well. But whatever is the low-hanging fruit can be solved, right? So as a part of this whole collaborative thing, I think a little more noise, a little more, data in the face needs to be done. As in, that's something that's really important. The third thing that we all need to understand is that when we talk about, collaboration, CSR coming into the collaboration, because I came in as a CSR, head at that point of time, the whole idea of CSR is to solve a problem, and especially strategic CSR. As in, there is, of course, CSR, which is not very strategic, and people are doing everything as a corporate. They're doing health, they're doing education, they're doing livelihood, they're doing skilling, they're doing road safety, without having much of an understanding of either of them. But when it comes to strategic CSR, I think the big difference will be like Mr. Arun, Mr. Rama will be doing road safety because they are good at road safety as a corporate themselves. They understand it themselves. They use their employees as volunteers in this journey. They spread the message of what is there inside their organization as a policy and a practice in the environment. Likewise, oil companies do it. Likewise, a company that manufactures automotive vehicles or, scooters does it. Likewise, a logistics company does it. As in, there's this small universe of people who understand road safety, and it's a strategic CSR for them when they do say road safety. What needs to be done now as a part of this collaboration is to keep expanding this circle. So if you remember, Anshu, you and I managed to convince the cement conglomerates to make road safety a part of their agenda. And they went down, the path with us, getting their truck drivers' eyes tested. We managed to come, multiple ports, right from Mangalore port to the Chennai port to so many other ports. We managed to convince the port authorities that, there are so many truckers lining up outside your ports. Road safety is a big issue, and, let's collaborate and make this happen. So the circle of influence needs to, kind of expand beyond the people who understand it and already, have it as a part of their agenda. How do we make it a part of the agenda of the Cokes and the Pepsis of the world as well? Because these logistics such road safety kind of actions. I think last but not the least, and I love the way Rajni spoke about, how she'd kind of made inroads with the government and, brought about so many changes. You need government on your side. As in it, if you think of one big program where the government, which was successful, whether it's COVID, whether it's polio eradication, all of this happened because government was hand in hand with everybody on that journey. None of this could have happened, with just the corporates or just the NGOs or just the individuals trying to drive it on their own. So it means a lot of knocking of the doors. It's not easy to get government to listen to you because they've got so many priorities. It does mean also finding the right person. As in, a lot of times you realize that it's also an individual thing. You speak to Anshu, he gets it, but you speak to somebody else, they think, oh, let me think about it. So, it's an individual thing. So find the right stakeholder in the government who gets it and then who becomes your ally in it. And I think then it's like just repeating these steps again and again. So there are multiple state governments, there are multiple, companies across the world. You keep doing this, knocking on the doors of different corporates, knocking on the doors of different, governments, and basically expand the collaboration and the reach of this whole initiative.
Thank you, Ekta. It was wonderful. Expanding the circle of influence, getting people on a common ground, because that's when collaboration happens, because everyone has a shared understanding of the issue. And also, like the examples, and you've been instrumental throughout our partnerships to push us beyond to different sectors and different avenues, and open more doors, and make more people aware of vision and road safety. So thank you, Ekta. We have 10 minutes left. I'm conscious of time, and 5 speakers. So I would probably direct one last question to each of the speakers. I would request all of you to be very brief. We don't want Viola to knock us out of the webinar, sharp in 10 minutes. So, so let's expect collaboration from all the speakers. And I'm also taking some, getting questions from the audience, but I don't think we have time for audience to engage directly with the speakers. So, I would, direct some of my questions in such a manner that I'm covering most of the topics raised by the audience today. So, Mr. Pandey, let me go first to you. How can we get the automotive, ancillaries, everyone who's in some way or the other cares about road safety, those sectors to focus more on the need for screenings and glasses? Very briefly, sir.
Yeah, so thank you so much, Anshu. The biggest thing we can do is, I think the automotive industry as such, whether it is at the SIAM or ACMA, these are our major 2 organizations. We all also have this issue. How do we get respect for drivers? The driver is an engine of this industry, especially from the commercial side. And if you can, I think, collaborate with our industry, with individual companies, that in their general normal way of working, because there's a business case to get them on their side. Different brands have different programs. I'll give you one example, what one of our magazine, Motor India, is doing. I think you can also collaborate with them. They are doing a happiness truck from Kanyakumari to Kashmir, all the other way, Kashmir to Kanyakumari. And they're meeting these drivers at every location. It's a large campaign. I think you should get in touch with these automotive media, these automotive brands, and ride on their own. Because as Ekta said, alone, whatever we try to do, shout with our voice that visibility is important. We know, I think all of us here are convinced. It is scientific. All the data is proving it. The first thing first has to happen. First vision, then the other things will happen. I think all this is well understood by us as a stakeholder. But probably what we need to do is put it in a normal campaigns, because these companies spend a lot of money on their normal business driving. So can we make it part of business? Can we create it in the incentive campaigns of these truck drivers? Because most of them have a lot of component and a lot of sales driven approach where they give a lot of discounts and coupons and a lot of stuff. Can you ride on that? That one of that can become an eye check, because the retail funding is the easiest to get rather than a big CSR discussion over many, many years. You need to really convince a lot of stakeholders. Here, it's very simple. If they have to give a torch or a gift to a driver, why not a vision? I think the drivers also will appreciate that. So I'll welcome you in that. I think you can also collaborate and talk to ACMA, talk to SIAM. They'll be very much willing. You can make a good case also that vision is the most critical. The seat belt, the airbag, all this discussion is there. But not every vehicle in a single day can be transformed. You need first thing first. India is a developing country. Our funds are limited. So in that limited fund, since last almost 15 years, I'm on this movement, of course, with a lot of lighting and signaling I've been working, that the visibility is a core, is a first. When you create billions of opportunity of crash in visibility area, then you have to spend much more in the, reaction and injury avoidance area. It's always like first is to see, and then you have the, the action or reaction, then you have the injury avoidance. We jump to injury avoidance. I think first we have to get this area covered. So you have a lot of good audience in automotive. Start with that riding on their own program rather than having a very special, programs. I'm very sure that they will support. Thank you, Anshu.
Thank you, sir. Thank you. Professor Vashisht, government is the biggest healthcare provider in the country. Nothing can happen without the government. And we've seen during COVID, what an amazing job the government has done. How could we solve this issue for our commercial drivers and the transport workers? It requires coordination between the Health Ministry and the Road Transport Ministry. How can we make that collaboration happen and get the desired results?
Thank you, Anshu. In fact, it is very clear that refractive error is a treatment for refractive error is the key. That means we need to provide a pair of spectacles to the people. And, when we talk about the National Program for Control of Blindness, who is actually responsible for policy change and initiative for providing spectacles in the country, the burden is so huge that nearly, as I mentioned, 25% of the population, they need spectacles. Recently, WHO shared a data on coverage of refractive error in different countries. We don't have the overall data of the country, but most of the places where data is available, it showed that just 25% of people who actually need spectacles, they are using spectacles. So even in your findings where you provided spectacles to various age group, you'll realize that nearly 75% of people, they are actually having refractive error and never use spectacles. So we need a massive change in national policy as far as eye health program. Currently, as far as these drivers are concerned, the commercial drivers are concerned, there is no system of their examination. The national program has given importance to two age groups. One is the children, school-going age group, where they expect that the children, because it can affect the eyes and it can affect the performance in their studies also. So what is the one program is that a school vision screening program under which teachers are trained, they screen children, school children, and then at referred cases, their reflection is being conducted and spectacles are provided free of cost. I'm sorry to say that the government of India has kept a target of 1 million spectacles. And as per our, information, so data is concerned, we need actually every year 20 million spectacles. So when this gap is there at the lowest level, the school level, you can understand the same gap will continue to higher level in this commercial driver age group also. So this is one area, and we understand the reason. For providing spectacles for distance vision, you need refractionists or optometrists, and that is hugely lacking in our country. As per Vision 2020 Right to Sight program, we need minimum 78,000 optometrists in country, and current estimates are actually with the qualified optometrists. The current estimates are just around 20,000 optometrists. So this number is itself 1/4. So this is the policy change is required in our country, that availability of more and more optometry schools, more optometrists who can conduct refractions and then provide spectacles. I appreciate agencies like Vision Spring who have taken initiative at such a large level in the country that they have partnership with nearly 18, if I'm not wrong, 18 states in the country, and they're helping and providing spectacles in different part of the country. We need such organization. Not one is not sufficient. We need multiple organization in the country who can take such initiative and provide spectacles. So as far as government is concerned, we are bound actually. We are bound with the number of trained optometrists. Though policy changes are required, we are bound. The priority age group is still in government of India. It is young children and adult with presbyopia. This is the priority in our country actually. What we need is a change. A change is that as per road safety program, these commercial drivers should be included as a priority in National Program for Control of Blindness. And in fact, we should have a kind of, I always say that whenever license facilities are there, they get a new or they have to go for renewal of their licenses, their proper eye examination should be must. They're submitting certificate. The medical MBBS doctor is writing that their vision is this much and he is signing that he is fine. But the MBBS doctor, they don't know refractions. It is the optometrist who should conduct refraction. Ideally, there should be availability of optometrists in all these agencies where license facilities are there. Then we can think of some minor change in the country. And this is the, people give money and try to get certificate from doctors. This should not be the rule. Ideally, what we need is proper examination, their refraction, provision of spectacles. Only then they should be allowed to go for actually the driving test, etc. This change is required, and therefore that we need collaboration at the highest level in the Ministry of Health as well as Ministry of Road Safety. There should be I think a kind of partnership that Ministry of Health is providing such facilities, and Ministry of Road Safety or Ministry of Road Transport, they are providing facilities to the health department. So that kind of integration is needed in our country. Thank you.
Thank you, sir. Thank you so much. I'll quickly go to Mr. Arora, and so we are short of time. So 30 seconds to answer this question. How can we get big funding for this issue? World Bank, UN, big organizations, big corporations. How can we get them to invest in this issue? Mr. Arora, I think you're on mute. We can't hear you.
I'm so sorry. Can you hear me now?
Yes.
Yeah, let me utilize these 30 seconds to bring about a point of what is that we can do instead of saying what is that government is not doing or others are not doing. Building upon the points raised by Dr. Vashisht and Mr. Pandey, what we are trying to do with our OEMs is, can we talk to them, do advocacy with them, and ensure then whatever trucks enter into any OEMs, they have to carry that visual verified certificate. We are trying to convince them. So every time any material goes into any factory, when any product comes out, so whoever is the driver, he has to carry that certificate in addition to carry his license and RC book. And we can organize checkup camps at those locations so that they can have those certification before they are let into the premises. So we have to find solution ourselves, because assuming license can be made across India without having to get the eye tested done, because he was saying MBBS sign, but not even MBBS, any tout can get the signature done. That is very sad. But let's not creep about that. Let's find solutions to what can be done to offset that. Can we have multiple checkpoints wherein we'll provide free checkup, we'll provide free spectacles, but wherever there is some transaction happening, those transactions will not take place unless the person who's driving the vehicle or the car or the bus, the example I had to share of somebody driving from Manali to Kashmir, he cannot drive unless he carries that certificate, and even passengers can demand to see that.
Thank you, sir. Thank you very much. Rajni, how can we have the road safety world pay more attention to this issue?
The most important
again, 30 seconds, Rajni.
Yeah, I noted already. So, frankly speaking, as an advocate or anybody who is advocating for any of the issue, data is one of the important aspects. We have discussed in the past also, and today also, I want to bring this into attention that collaboration way. Let's start the first step. Let's collaborate and have a good research so that we can put it in the next Ministry of Road Transport Highways Accidental Report of 2022 also, because it is still missed over there. Once it is there, you can actually, get the attention of the corporate or other stakeholders or the road users ultimately, that how to, get this idea also, which is still unrecognized or being avoided a lot. So this is an important aspect, and I just want to bring into your attention that in case of SDGs also, like we are talking about that how we can talk road safety and all. So even SDGs also, not even 3, even 11, even 16, and even 17, we are talking about. So something is already collaborating in another way. So we need to get data in our hands so that we can advocate the issue, not nationally, internationally as well, and we can bring some good case studies.
Thank you, Rajni. Ekta, any final thoughts?
I think a lot has been said, Anshu, and all of it's so valid and so right straight from grassroots level. I couldn't agree more with, Arun saying, let's do it in our house. Couldn't agree more with the torch t-shirt versus an eye checkup. In fact, we tried that in our own a business and it worked very well. Instead of t-shirts, they did eye checkups that year with you. So like Rajni is saying, data is so critical. I think the steps that I would like to kind of just share over here is that do it with the partners who are already on board. Bring that data to life, as in bringing that data to life with an RCT or whatever. Anshu, we've been speaking about it for some time. I know that you're already on that path. So, once that happens, maybe make it more tangible for everybody to understand that, yes, this does lead to road safety. It's not just intuitive, but there's real data around it. And then taking it to the right people, like Professor Praveen was saying, to the government, to the right people, to make them understand that this little policy change needs to happen. You need to get commercial drivers into the wing of this. And then last but not, let's not forget, Anshu, it's not going to be corporates and Vision Springs and NGOs solving this. There's a whole network of hospitals that exists, right? Which needs to be brought into the fold of this as well, where a driver should be able to go in when he's in that city to get his eyes tested for free and walk out with a Vision Spring glass or whatever. So there's a network that needs to be tapped for this as well. Like polio, it was not like they were setting up fresh camps for it. There were existing Anganwadis and existing, infrastructure that was leveraged. So something to that effect that needs to be thought through as well.
Thank you so much, Ekta, and thank you to all the panelists for joining today. I think raising awareness about this critical issue and bringing it to the forefront of public debate. I think we've seen the importance of the issue, how much difference we can make to people. How much difference can we make to our lives? Every time we go out on the road with our family on the highways, this is something that can affect us. So on that note, I would like to thank all of you. I would like to thank our wonderful audience, and also like to thank Catalyst 2030 and WILA for giving us this platform to discuss this important issue. There are 4 E's of road safety: enforcement, education, emergency response, and engineering. And we just hope that the 5th E is iCare. And with that hope, I would like to thank all of you again for joining us today. Have a great day.
Thank you. Thank you so much.
Thank you, everyone.
Thank you.
Thanks, everyone. Bye-bye.
Thank you.
Thank you, everyone.